live.
A very good evening to all the spectators and viewers of this podcast. My humble regards to President Fogsi, respected Dr. Sunita Tandulwadkar, Madam, and I extend a very warm and heartfelt welcome to our guest speaker today, Dr. Vikas Mahatme, sir. Today we
Thank
are
you.
live
Namaskar.
telecasting. Welcome, sir. Today we are live telecasting episode number 202. And this series is called as Gyan Pravah. ज्ञान का बहता अनोखा रोज एक नया रंग हर रात 8 बजे आप जुड़िए फॉक्सी के संग. And this is a phenomenally successful, globally run podcast. This project has been conceived by, and this idea is a brainchild of our president, respected Dr. Sunita Tandulwadkar, Madam. She needs no introduction. She is the president, Foxy, and president-elect ISAR for next 2 years. She is a regenerative medicine specialist, a great endoscopic surgeon, ART consultant, and she is managing the most high-risk cases of obstetrics and gynecology. This we all know. She has been running many social projects like the cervical cancer elimination project, thalassemia eradication, and her main emphasis this year is on preconception care. And a very spiritual person deep at her heart, she is also known for her many philanthropic works. She is running a project where she is sponsoring births for infertile couple free of cost and many such projects. With this small introduction, Madam, we would like to hear from you on this occasion.
Thank you, Rashmi. Thank you for your kind words. And I congratulate you being a part of such a mammoth series. 200 plus podcast is not, I don't think any organization have done. And at the end of a year, 365 podcast, we will be having so much huge collection. I think we need to brainstorm what we should do with such a beautiful collection of 365 leaders across the globe. And Dr. Mahatme, welcome to the Fogsi platform.
Thank you.
It's our honor and a pleasure to have you on our platform. And Rashmi, you are a very sincere, dedicated chairperson who works and who is willing to work for any responsibilities given to you. You are really a deep asset to my team of Foxy 2025. And I definitely feel you have a very bright future in Foxy and otherwise. Dr. Mahatme,
Yes.
our podcast series is that I just joined to welcome you all to show the honor and respect to the faculty who is joining for Foxy. And then you both are in the frame, and I start listening to your conversation, your podcast, your dialogue from the viewers link. So thank you so much for taking out time for Foxy and being with us tonight.
Actually, at the onset, I shall like to congratulate you because this is for the first time, I think, such a large series of podcasts by one of the very good organization, Foxy, you are conducting. And of course, Rashmi, all through, was very supportive. She told how to go ahead and how we should have this podcast. I feel that these things should be propagated to other societies also. Other societies should follow you. And really, it is a nice thing so that all the thoughts, ultimately, what our perceptions and thoughts, we create the world. So this is a very good series, and I hope my contribution will be to this series too. Thank you, the Foxy President, Dr. Sunita, as well as Dr. Rashmi.
Thank you, sir.
Thank you, sir. And I would like to briefly introduce Dr. Vikas Mahatme, sir. He is the former member of Parliament, Rajya Sabha. He is former president of AIIMS Nagpur. Padma Shri has been awarded to him for his work as an eye surgeon of international repute. He is known for his significant contribution to community eye care and has himself performed over more than 1.2 lakh surgeries. He has been awarded with DLIT and he is an executive chair of GCPR, that is Global Council of Political Renewal. He has developed woodcutter's nucleus cracking technique for phacoemulsification, tattooing pigment for cosmetic corneal tattooing, and he has contributed to research and has received the highest national award for research in ophthalmology, that is Colonel Rangachari National Award and Gold Medal. He is former medical director of Mahatma Eye Bank, Eye Hospital Nagpur, and Mumbai and Amravati, and I think Pune also has one branch. Mahatma Eye Bank Hospital is a recognized postgraduate teaching institute for DNB, DOMS International Fellowships, Training Center for Government of India Eye Surgeons. The institute also runs skill-based ophthalmic technician course for rural youths, thus empowering them economically and skill-wise. This has been affiliated to Nagpur University. We will be talking in detail about it. And he is a social worker and reformer, and he has designed weighted indexing system for caste-based reservations to right people. He runs institute, most important, he runs Institute of Science of Happiness for thinking skills, emotional and psychological health of the community, ultimately for happy, meaningful life, and works for right to health for the community. It's a great honor, sir, to have you with us today for this podcast.
Thank you. Thank you for the great
Thanks, sir. We
introduction.
would like to let's discuss sometimes after this podcast.
Ha.
If you have so much of a research, I think macular degeneration and
Mhm.
losing the eyesight, can we think
Yes.
about having the regenerative medicine? We should be
Yes.
doing something differently, sir. And
Ha.
I definitely wish to work because with the stem cells, I could say give my mom at least 6 years of a very uneventful life. But my father had a macular degeneration, his eyesight had decreased. And unfortunately, though I had the stem cell, I did not have any ophthalmologist who had an interest in developing this subject of macular degeneration with regenerative therapy. But I see many papers are getting published on it. And definitely, sir, you should be the one who should be doing the research. I'll be more than happy to join you, and we can have a like-minded people coming together and working with the strict selective criteria, and let's see how we can go ahead. It will be one of the gift to the mankind if we can work on a macular degeneration.
Dr. Sunita, it's a very good idea because uh, we are not associated. We have compartmentalized this compartment have been created ophthalmology and other departments. But it's a nice idea to work with you on the regenerative medicine. And of course, the macular degeneration day by day is increasing because the lifespan is also increasing.
Increasing.
Yeah. So that is a very good idea, and collaboratively only it is possible because we
Absolutely.
independently
You
cannot
are
do
in
it.
a political background. You are an ophthalmologist. I'm here to help you.
Yes,
Regenerative. Let's work. Let's submit the data to ICMR, the project, get something from ICMR positively. And let's,
yes,
even in 10 patients, sir, if we could do that, it will be great. I
yes.
definitely feel we have to do something for those.
Yeah.
Thanks. We will
Definitely, we will go ahead with this project.
Rashmi will share my number with you, and it
Yeah.
will be honored to discuss this, sir. Thank you.
Yes.
Thank you.
Thank you so much, madam.
Uh,
Very good evening again, sir. Welcome to this podcast.
am I audible? Because
Yes, absolutely, absolutely.
okay, fine.
Yes.
So,
The highest research award in ophthalmology, that is Colonel Rangachari National Award and a gold medalist. Surgeries more than 1.2 lakhs, and innovations of some instruments for surgeries like the woodcutter's nucleus cracking technique for phacoemulsification, tattooing pigment for cosmetic corneal tattooing. So, how was this amazing journey of yours in ophthalmology, sir? We'd like to know about it.
thank you, Dr. Rashmi. It's a great honor to be with Fogsi. And This is a thing which I shall like to share my views, my perspectives, my uh, thoughts also. So what question you asked is very important. How was the journey? Really speaking, we started with an iBank and with a zeal of serving the people, communities especially, and I started with a charitable trust. So mostly we start with the private practice. I started with the charitable trust, and fortunately, as we built up the team, because it's not a single person who can do all those things, we can change. We can give the people feel that we have given the sight to the people community. As you said, more than 1.2 lakhs and totally more than 2.5 lakhs. We are given sight. But I feel we have changed the world of these people.
Yes.
Just I shall tell you an example that once I operated a very old lady. When she met me, she told me, Doctor, I can see now the smiling face of my grandson. So that is what we want, and that gives a pleasure, that gives a meaning to the life, and that is what everybody wants really, happiness with meaning. So that was about the community medicine. You can see that we have to go ahead with the community medicine. I just wanted to add to that because when we say community, everybody feels that okay, we are professionals, we are obstetricians, gynecologists, we are nephrologists, we are orthopedicians. But it's not true. Every branch has a community part. As you are aware, you people are doing so much community work too. But just how we move, we are very intelligent. Everybody is very intelligent in Foxy, not only Foxy, in our own profession. But we are driven by the market. I tell you, for example, if I ask you, and all the Foxy members also, that how many of you got vaccinated, adult vaccination is there, and know about vaccination? Many will say they have not been vaccinated. What is most important in life? Most important in life is life. So vaccination will prevent. Above 65, pneumococcal vaccination is there. How many deaths are occurring? Even I have seen of doctors because of pneumococcal infection. This is an infection, but that can be prevented just by a vaccine. Then we have DPT, diphtheria, pertussis, then tetanus, then herpes zoster. Many must have seen. And for the cancer also, as you know all, there is a vaccine that HPV. But that is for men also, that prevents cancer in men. So all this is not a flu. There is a vaccine. But how many people are taking adult vaccine? Because we are more bothered about illness. Now let us concentrate on wellness. Self, at least from self, we should start. That okay, we all will get vaccinated and adult vaccination is the most important thing. So from illness, let us move to wellness also. And Foxy is doing that, but on a larger scale. This is a perspective. The community work is a part of every specialty. You people are working on breast cancer, cervical cancer, so many vaccines. So how many of you have given vaccine to your own children, child, or nearby relatives? That is also a question. So let us think of that too. That was about the what I feel always, as we said, preventive and social medicine. So this is what is more important, I think, prevention of diseases also. Many times Foxy people will ask me, why you say that, but it doesn't add to our practice anything. But I tell you, community work will benefit. In what way it will benefit? It will give meaning to your life that we are seeing. Then teamwork. Unless and until you do teamwork, it is not
Yes.
possible. It is not necessary that a professional like a MD medicine or MD gynecology should go. MS or MD, should go to the community work. But he should train the paramedics. I always feel that there should be a pyramid. One doctor, at least 10 paramedics should be there so that they can go outside. Many people nowadays think of relationship managers. I feel if you do the community work, acts as a relationship manager only because the community people come to know you about you and your work. It becomes holistic approach. We say mouth to mouth publicity is necessary, but so many people you should approach them. Then only mouth to mouth publicity will happen. So together, I feel we shouldn't think like USA and UK. Their population is so small. We have 140 crore people. So you sit inside the chamber, I don't say, but plan for a community outside. Somebody else will be working for that, but he will definitely add to your practice also. So that way, win-win situation is there. It's not. That was
Absolutely
about this.
resonating with your thoughts, sir. I would like to just say a
Ah,
line that Foxy is really deeply involved into community work as an
yeah,
association.
yeah,
So there are many projects like cervical cancer elimination,
yes,
thalassemia eradication, and also sir breast cancer elimination or creating awareness, many public awareness programs. So I can say on this platform that as an association, Foxy is really doing great community work and helping many people in community for prevention of diseases. And so,
yes. Ah,
so that is something I
yeah,
would like to mention. And
yeah,
see,
yeah.
when you speak about this community work and your work in community as an ophthalmologist, so this is huge, magnanimous work. I would like to say, sir, that this has set a benchmark in the community. Your work is known not only in our area, like Vidarbha region, but also all over India. You are known
Mm.
for your work. I must say, sir, I think that something from this work must have motivated you to enter politics. So what was that and how was that? Yes.
I definitely to start with congratulate Foxy and Foxy members that community work is been done. I just wanted to link that to individual also, so that individual will not think that it is not possible. I just want to say, just think on that perspective. Let take time to think on this way also. What Foxy is doing is a is always be guiding principle for all the members. So that is good that you told me, and it's a great thing. What you asked me was also a good question, and everybody wants to ask me that you are a professional and you have done so many surgeries or something like that. But why you want to enter the politics? Politics is not for
Why?
those
Because a
who.
doctor who is a politician is a very valuable thing for our fraternity.
Oh,
So
thank you.
about it, but I want to know, sir, what motivated you,
Yeah.
what made you enter politics?
Yeah. I shall like to tell you. Till now, I thought that I am treating the diseases of eye diseases. Let us think of diseases of the community, diseases of the people, poverty, inequality. These are the diseases, and they should be treated. And what happens in charitable system is very good, but I always feel there are certain drawbacks or disadvantages you can say associated with anything good thing. There will be some challenges also more. Similarly, certain challenges are more. That is scalability. Means if you want to increase the corporate sector, or it becomes more easier because the money will come inside. Here there is no money, so that you cannot grow faster because of service orientation. It becomes difficult to grow faster. So I thought to serve people, politics will be a better option, and common people will be benefiting. I always feel that intelligent people should be in politics, but everybody feels that it is very tough. Yes, I do agree. But you just see, in the morning you wake up, you brush the teeth. But whichever toothpaste you are using, you will see nowadays more Ayurvedic toothpaste are coming. Why is it so? It is the politicians change the perspective of looking towards that. And then many private sectors came in, and it was an easy movement for them. And of course, everybody benefited. But the politicians decide what you will do starting from your day. They decide. So that is what is important. And that's why intelligent people should be there in the politics. It will not be that everybody will be, but some impact will be definitely there. And when it is not, like Foxy, make some advocacy group where all these people are involved, which are member. Nowadays, I tell you, more doctors are in politics. So there should be advocacy group. Always involve this member of parliament, member of legislative assembly, or those who are in the politics. Though they should be, they are members, so you can make them advocacy group, so that whatever you want to get it implemented will be easy for them. It's easy for them. And due invitation and due respect, if it is given, everybody is ready really, because they are the part of the Foxy or any other organization. So that was about this, and people feel that what changes you can make or something like that. I tell you, just one thing I raised the issue in the parliament, that what happens, a surgeon or a gynecologist, if a case of rape is there, gynecologist will do the examination, everything, and then the case goes to the court, and then the gynecologist has to go to the court and waste their time. Many days will be full wasted. So this shouldn't happen, because you are not expert in that. The forensic medicine people or medical legal jurisprudence people, they are experts. So what I suggested, that clinical pharmacology fellows, lecturers or fellows should be posted into casualty. So when these cases of medical jurisprudence or medical legal cases are there, they will also examine, and they will write their whatever notes are there, they will write findings, clinical. And along with that, suppose that is a rape case, they will do all the examination, everything. They will take the help of gynecologists. That is not a big problem. Like in surgery also, we take the help, surgery, gynecology, something like that. They will take the help of. But ultimately, they will be pleading the case in the court. So these are the primary face of all the medical legal cases. So the greatest advantage will be the culprits will be given the punishment. Otherwise, what happens? We are not expert in legal factors. They are experts, and both will be win-win situation for the culprits, as well as gynecologists will not will solve their problem of going to the courts and wasting their time. Secondly, I supported many things which are atrocities. We will come to that also. But One Health was another issue. One Health means the diseases are not only because of human beings, they are from animal origin or environmental changes also. So that when these three factors are considered, it is called as One Health. And this concept is not penetrated in our country. So I asked the government to have one health center in Nagpur, and I was behind the secretary and minister for that. But secretary said this is not very important. It will take unnecessarily our funds. But when the COVID came, she herself in the meeting told everybody that he was insisting, and COVID is generated through animals. So let us consider now One Health, and in the Nagpur we could set up One Health first, one health center of India there. So these are the things which we can do when we think of the politics. So
Because, sir, as I already said,
mm,
a doctor who is a politician
mm,
is very valuable thing now in medical
yes,
fraternity. Why? Because daily we are seeing the cases happening or the violences, etc., happening against doctors. So
yes,
we can
yes,
say that to some extent, this doctor-patient relationship in the community has jeopardized. There are
mm,
some definite, so there is some definite hope to a doctor, to a common doctor, that his representation is going to support that particular doctor in these cases and also going to help. But I would like to know from you, can we prevent these situations basically? And if we can, what we can do to prevent and how you will protect us? So,
yes. That is the most important question, I think, because everybody is affected by this. And really, it's very sad that the violence or the atrocities on the doctors are abused. So I have raised this in Parliament 2, 3 times because I remember there was a case in Dhule district. One of the means the relatives, there was violence against the doctor on call who was working in the emergency. But I told in the uh, Parliament that I am representing the common man, the public. I tell you that we say when he has been beaten up, doctor, no other doctor, a new coming doctor, is ready to serve in government hospitals. And we say that we do not get good doctors. So, who is ultimately at loss? At loss is public. They are not getting the services of the doctors in government hospitals. They have the shortage. In periphery, there is nobody to go. So all this is because they feel why not to go for other alternatives which are better. So we should, one thing is that is the prevention. And another thing, what I told you, how we counsel the public that they are at loss when the doctor is, it's not he himself alone, it is the public at large is suffering because of that. Wherever the violence against doctor is there, it is the violence against the society. It is not
yes.
against the doctor only. Secondly, as a public representative, I want that the laws should be there. And I tell you, are there. But the implementation is very weak at all. Nobody wants that implementation because what are the challenges in implementation at all? The most important challenge is that the member of legislative assembly or member of parliaments want to show to the people they are on the side of their side. They don't want to be on the side of a doctor at that incidence place. And that's why unitedly we have to fight this when incidence is there. Just FIR must be there because usually there is a pressure on the police that FIR shouldn't go because he is our own karyakarta or our own person, something like that. So this shouldn't happen. And the stories are built around that. That shouldn't be allowed. The truth should come because what happens as a professional, I don't want to tell others what I have done or something like that. But these people are very vocal. So they stand in media and tell their one side. And we do not do that. And then there is confusion or the confusion or on one side only people listen. So automatically they feel that that is the correct. So we have to be vocal or see people who are vocal and be part of that team so that the proper picture, we do not want that improper thing should go, untruth should go, but proper picture also should go to the public. So that is what is important. And for prevention, now we do have the emergency bells and other things, but there are certain things which are needed in the emergency room. But there are certain things like a emergency bell, or only two relatives should be allowed in government hospitals or big hospitals. But there is one thing which is more important, is the counseling and earning the trust. That is also important. So we can say something as prevention. So something when the things this occurs, and I think perception of people should be changed. They feel as if we are God when the treatment is, when the results are good. But when the results are not good, they treat us as a demon. You have to tell them that we are neither God nor demon. We are human beings. And we put in all our efforts. And
So,
mostly we pray the God for the good result. So results are not in our hands. This perspective has also to be changed. That is what I feel. And I hope that unitedly, if we are there and advocacy is there, and if we can put in the gradually this incidence will be less.
so as a doctor, to
Ah,
you as a politician. So at one side, I would say that, sir, we are a smaller group of people. We are soft targets.
yes.
But at the same time, I would like to know, sir, so this role of communication or the doctor and the patient relationship, like in earlier days, how the patients used to see to go and see a family doctor, the bond and the super specialty practice that has, or the corporate practice that has evolved. So, what is your
Hmm.
take on that?
Yes, we are a small group, and doctor-patient relationship. You wanted to know about that. Uh, Previously, we had family doctors. Now that concept is gradually going down. But I feel family doctor is also a specialty really, because they have to learn nowadays many things. Because many times, sometimes they may blame family doctor that he has referred late, but it's not possible every time that at first sight only you will be able to diagnose it. So family doctor should be well trained nowadays because that is the requirement of the people. But I feel family doctor is a necessity also. Family doctor knows your story, and specialist knows your scan. That is there.
Yes.
So there is the difference. Family doctor is a person who knows everything about that patient, not only disease, patient, family, the surrounding financial condition, and the culture from which he is coming. So, what will be his thoughts? What will be in his thoughts coming in his mind now when I tell this? That is, he knows very well. But specialists are 10 doctors who know part of the body only. So, we want both and a good mixture of that.
A gynecologist is almost as good as a family doctor in your
Yes.
family. And you yourself are surrounded by so many gynecologists in your family only. So you will
Yes.
definitely agree with me in
Yeah,
this.
yeah. I shall add to that obstetric and gynecology, because nowadays gynecology is a different branch in obstetric.
Yes.
So yeah, both they act as a family. And if you see, what you say is very correct. Many obstetric gynecologists are females, and they are. Uh, I feel it's a very tough job to run a family as well as to be a gynecologist obstetrician. Is too tough because both things are demanding, and both are nearly 24-hour services.
Yes.
And still, that is done by all of you. I salute to you all because I think it is very difficult task
Yes.
as compared to ophthalmologist, definitely. And what is important in doctor-patient relationship? People feel that patients should keep the trust. They should keep the trust on us. No. Trust is never kept. Trust has to be earned. You have to do activities to earn the faith of the patient. It cannot be passive. Like I tell you, if somebody comes, okay, I don't want to go to the office and I need a certificate that I am ill and give me rest for 7 days. You give the certificate, he pays and goes. Now the challenge is that he feels, okay, when he treats, when he comes for treatment, he feels that this doctor is behind money and he can manipulate us. So the trust has gone down. So you will not do like things like this because the challenge is of the trust. It is not about the certificate. Challenge the trust on the front person. Secondly, nowadays insurance is covered by of the many people. So insurance person comes and says that we will pay only this much for this disease. We will say that it is very less. He says, no, no, what you do, per visit you can charge 300 and you can show three visits instead of one only. You are visiting one, but you can show three visits. Per visit charge is 300. You do like that. When the patient sees that, then they understand he has visited only once and he has charged three times. Okay, insurance will pay. That is true. But what is going in his mind? That this doctor can cheat me. So unnecessarily, the trust is reduced. Third thing, I shall give you an example. Nowadays, all corporate sectors, the new doctors coming out, they don't have anything, but they will have to, no investment is possible for them. They don't have capital. So they join the corporate hospitals. Once you join the corporate hospital, they tell you that you should at least earn so much of money from the patients who are coming. That is a financial targets are given. And once the financial targets are given, the person has to run behind it. The system is like that. So actually, Foxy, IMA, these people should observe this. This will increase the image of the Foxy as well as IMA, that for the people we are actually fighting for the people, that nobody can give financial target to a doctor, to a specialist. That is very important.
This is
But you
very
can see, and this will, this has a win-win situation. The newcomers will be very happy, as well as the people will say, no, no, Foxy and IMA fight for the people's health. Both the things are there. So this way, we have to earn the faith of the people, earn the faith. And I think that will increase the doctor-patient relationship. And we have to be very careful that the faith, if it is going down, we will not do anything in that area. Better
yes.
not to do anything rather than do the things and then repent afterwards as a family of all the doctors. So, because one doctor means for that person, every doctor will be of same age. That is there. So, that was there about this.
This is an absolutely eye-opener discussion, sir. Sir, I
Thank
want to
you.
explore one more
Ah,
thing of your work area. So, for the upliftment of rural youths,
mm.
you trained them, you gave them skill training, and so many lives you have set, their families have been set. So, what was that actually? We would like to know about it, sir.
I tell you,
And how the
uh,
doctors can also do this for their staff.
yes. That is a very good question, I feel, because we have a feeling what happens in History of Science of Witness, we teach this also, that we are expert in our field. We have been taught everything about our field. We know much better than so many other doctors also in India, especially. But the challenge is like in circus, I tell people. Circus, suppose a tiger cub is there. He has been taught that in the circus that okay how to stand on the stool, and then in the fire ring he has to jump, He can do everything. And suppose that cub becomes a tiger in 2 years, big tiger, normal tiger, youth, and then you send that to a jungle or a forest. What will happen? Will he be able to do hunting? No, not possible at all. What has happened? He is very intelligent. He can jump through a fire ring, but he doesn't know life skills. Similarly, the challenge with all of us is that life skills are not. That's why depression, suicide amongst the students, amongst the doctors is very high. Because we feel very awkward even somebody points out your mistake or if there is a failure. In examination, we don't want to fail and we never failed. But in life, we may fail many times. And it's not, you cannot see a single person who has never failed. So, but that failure, how to take that? That is a big problem. So, this is what happens with all of us. That's why I tell you that let us have these paramedics. Why paramedics are needed? Because I think if you even any branch, even a paramedic, if you train them for blood pressure, weight, height, nowadays many are using, but then the blood, you can blood take the blood samples and basic things which you are doing, can they be transferred to paramedics? Think of that. Not only in that, I feel many times the nurses, if given well trained, they can do normal deliveries. And now government is propagating that. So, because why we people have that normal deliveries number is coming down. But let us train now nurses, let us train common 10th and 12th pass students so that they can do what we are doing unnecessary. In our branch, we were taking vision of the patient. Taking vision of a patient takes lot of time when the patient is illiterate. C chart, dot chart, where from that. But that is taken by, if you give 3 months training to 10 pass, you will. But we are giving more training. They can handle the instruments. Many are skillful, but will not be able to express and write. They are very weak in writing. They are very weak in expressing themselves, but they are good in doing. Suppose a carpenter. If you say which wood, he will say this wood. He will not be able to describe. He will do the table, but if you give him a paper, how to make a table, write down here. He will say, I am not able to write. I can do. So they are doers. So these doers are doing very well job, and let us explore them. It's a win-win situation for both of us. And unless and until I told you previously, so 10 people are there, we cannot do that. And I think this will be the game changer in our practice. If we have many skilled persons who are doing their job very nicely and we teach them and hand over them. So forget that. So that will be better. And that is how they help you. While learning also, they can help in reducing your workload. So that way also they are. So it's better to have this paramedic courses.
So, I would like to know especially about this thing, happy, meaningful life. So that encompasses thinking skills, emotional and psychological health of the community. So, what
Yeah,
is implied from this?
yeah. For what we are working, everybody. People say that I want money, so I am working. From money, what we want? Money, we want that what we like, what will give us little bit good feeling. For that we work, really. From money, what we get. I feel sometimes, no, I go to the movie even if I don't like because my wife wants it. Really, it's not. It's when the wife is happy, I feel good. That's why I take her to the movie, though I do not like. So that is what everything is needed for something good feeling, good feeling in the future or the. But we do not know What we want, we study surgery, we study medicine for so many years. But what we want ultimately, we do not do study for that. I know about stars, I know about universe, I know about earth, I know about water means H2O, but I do not know how emotions are created. I am thinking throughout day and night. Thoughts are there 24 hours if you are alive. But I do not know how to manage those thoughts, how to manage, how the emotions are created. One thing, even in Institute of Science, I tell everybody, even if you learn this much, then it will change your life. That emotions are created by your thoughts. The thought which is more powerful will create that emotion. So it is not the outside thing. It is our perception to look at that thing creates emotions. And emotions ultimately give rise to action. Thoughts will never give action unless and until it converts into emotion. Thoughts will never give rise to action. So these are the principles I am telling you, but even the MBBS doctor doesn't know. We have never been taught about it. And we want happiness, we want good feeling, but we don't know how, we do not want to learn about it. So instead of science of happiness, we'll tell about how to manage the thoughts, how the emotions which are healthy we should create, and what are the behavioral changes which we want, then what should be the thoughts, what should be the emotion behind it. So that way we can all be doing, then I think we want Vikasit Bharat. Everybody wants that. But unless and until Bharatiya are Vikasit, you cannot get Vikasit Bharat. So let us concentrate on how we get Vikasit Bharatiya. And once the thoughts are managed well, emotions are managed well, of course, then automatically behavior will be managed well as we want for that role. So then I think Vikasit Bharat will be there.
The conversation is so interesting. I think this topic will need a special one more
Yes.
podcast to go
Yeah,
into
yeah.
details. So I would
So,
like to continue, but we have time constraints, sir.
yes,
So
yes.
I would like to know your message to all of us through this podcast.
Uh, Actually, it's difficult, but definitely message, not message, but what I feel that I can tell you. I think it was a very good feeling to discuss with you, and you asked very good questions for that. And your Foxy is doing so well. I'm very happy. It's a federation of all of them. So I shall like to tell that ज्ञान की जोत जगाते चलो प्रेम की गंगा बहाते चलो ज्ञान तो चाहिए we want knowledge but we want emotion good emotions with that and that is love affection for all and at least let's just have WHO has said that we should have life skills and everybody should be taught about life skills. Let us start from us, from ourselves, to learn about life skills. That is thinking, emotional management, and behavioral management. So this will form a happy society, and self. We will be all happy with that, and ultimately, Foxy ki jai ho, because you people are organizing so many podcasts. It's a really hats off to you all organizers and Rashmi as well as Madam Dr. Sunita. It was nice talking to all the
Thank you, sir.
audience here. Thank you.
Thank you, sir. And it was actually a very great honor for all of us to have you with us today. And with this beautiful concluding note, I would like to say very goodbye and very good. Thank you very much for your time and your guidance. And it was an inspirational podcast. Thank you very
Thank
much
you.
for joining us.
See you again, not bye.
Yes, yes, yes.
Okay.
And I express special thanks to technical team also. Thank you very much.
Yes. Thank you. Thank you,
Thank you
everybody.
so much, sir. Thank you so much. Good night.
Thank
and
you to
very
the audience, because unless and until they are there, we cannot be motivated. Thank you.
Thank you, sir.
Thank you.